Hello, welcome listeners to another episode of Prescribing Lifestyle Podcast. I'm your host, Dr. Avi Charlton. Today, I've got a special guest all the way from Norway. It's Dr. Torkil Færø. He's a GP and an emergency physician. He makes documentary and is an author and is a photographer. He wrote the book called The Pulse Cure, which is very interesting, opening up a whole new world of monitoring your pulse, especially HRV, which is heart rate variability. So we're going to go into this topic and ask him all sorts of questions what HRV is and how we can use heart rate to cure our illnesses. Welcome, Torkil.
Thank you, Avi. It's great to be here talking to Australia.
Yeah, we're on opposite sides of the world. Thank you for connecting.
Yeah, we're getting towards spring here and you're getting towards fall. Yeah, interesting.
Yeah, yeah, we're still quite warm. We had quite a warm weekend that's just gone, but it's getting colder.
Mhm.
Yeah, so how did you learn about the pulse? And just tell us about your journey.
Yeah, of course, the journey is a long one. I'm
Mm-hmm.
a medical doctor, general practitioner,
Mm-hmm.
emergency physician. Been working for 26 years, doing being mainly a freelance doctor, working intensely for short periods of time, then going traveling off somewhere or doing photography or doing different adventures. I always did not care about my own personal health really until my father died some 12 years ago. I focused on my own health. I could see that I was not living, I hadn't prescribed the right lifestyle for myself, so to
Mm-hmm.
speak.
Yep.
And I changed my life around, cutting alcohol, starting to exercise, caring about what I was eating and sleep. Everything that we now know, and of course your podcast is based on it, that now know how to create health, but that we did not learn in medical school. So
Mm,
I kind of started medical school 2.0 on my own time for my own sake to live longer and healthier.
mm,
So that was my main interest. And somewhere along the way, I was doing photography courses. I was teaching workshops all around the world in photography. And I got to understand that the autonomic nervous system that we learned in medical school was fight, flight, and freeze, and rest and digest,
mm,
had more to it than that, that we were also using the autonomic sympathetic system when we are doing photography, when we are doing fun and hunt, I would
mm,
say. So that is how I came to know that heart rate variability is a measurement of the state of our autonomic nervous system and the importance of it.
mm-hmm,
And then for 2 years, I was using a device with the ECG device taped to my chest.
mm,
And after a couple of years of gaining insight into the autonomic nervous system that way, I understood that you could also get the same measurements in the Garmin watches
mm-hmm,
and other devices as well, like the Whoop band. And yeah, I just understood that this is super important to get this knowledge. And as there were no books about that, I had
mm,
to find out everything on my own. And the Pulse Cure is, to my knowledge, still the only guidebook onto how to do lifestyle medicine compared to the results that you would get on your smartwatch or on your smart ring. So I had to do the detective work myself because I'm a very calm person.
mm-hmm,
So when I started measuring, I would expect to only see myself in the parasympathetic restful mode because
mm,
I'm never in a fight, flight, and freeze mode,
mm-hmm,
more or less then. And what I saw surprised me. I saw that I'm a stressed person almost all the time.
mm,
And then I realized that, okay, it's not only mental stress that is important, because I could clearly see that what affected my system and many others as well is food, is alcohol, is lack
mm,
of sleep, is nicotine, different stuff that will, you know, be like energy thieves that you become aware of when you start tracking your heart rate. Because the heart rate responds to any demands on it. And of course, as an emergency physician, the first thing I look for in a patient that's coming in is a heart rate.
Yeah, yeah,
But you can also use it for smaller differences in everyday life. And with these wearables that I'm talking about in the Pulse Cure, they're, they are on your wrist 24/7. They
yeah.
track small differences so you can identify energy thieves that will drain you of your energy in small amounts at a time. But
Mm.
still, when it goes on every day, it will be a significant factor in your health. And I'm sure as you both have the Whoop band and
Yeah,
the Garmin, you will have some knowledge and some insights that you wouldn't necessarily know without these devices.
yeah, yeah, absolutely. I was telling Torkil that I wear a Garmin for maybe the last 8 or 9 years since I go running. And my Whoop, I've had it maybe a year and a half because they sold a freebie free month for me and and then I keep wearing it and I decided that I pay for it and because I like to see the metrics of how I should train according to my heart rate variability. So can you explain to us what exactly is HRV? What's heart rate variability? What do we measure?
Yes, what we are measuring. Then I think we first have to explain what the autonomic nervous system is.
Mm,
So the autonomic nervous system is the self-regulated nervous system that is the foundation of our, complicated brain system. And it's a system that is like 300 million years old. So we share it with mice and mammals and vertebrates. So it's a very basic, kind of simple system that we
mhm,
have largely overlooked as doctors, looking at the more complicated human prefrontal cortex, with all the intellectual thoughts and innovations and everything that makes us human. But at the bottom of this system is the autonomic nervous system that has an on and an off function.
mhm,
So the on system is the sympathetic, stressful mode, the survival mode that makes it possible for us to chase something or run away from something that chases us. But we cannot stay in that state all the time because it will be too much stress. So we have an off system that is the parasympathetic mode, the rest and digest and recovery mode,
mhm,
which where our immune systems will work better and regulate the functions in the body. So it's like when we are in the stressful mode, we need to survive this moment, and everything of maintenance work, so to speak, will be put off until we get back into the rest and recovery mode.
mhm,
But the problem in our society is that we are more or less in a low grade of the sympathetic mode all the time. So
mm,
we are not enough time in the down state, in the restful state. So the good thing is that the heart rate variability will show whether we are in the restful state or in the stressful state.
mhm,
Because when we are in the restful state, then there will be a very huge variation between the heartbeats. Not huge maybe, but it will be larger than if we are in the stress state. So in the restful state, when we breathe in and our lungs fill with oxygen, the heart rate will take advantage of that and beat a little bit faster.
mhm,
And when we are breathing out and there's less oxygen in the lungs, the heart rate will slow down just a little bit, measured in milliseconds.
mm,
But when we are in the stress state and the body interprets that this organism is in danger, we need to use all available forces, even when there's less oxygen in the lungs. So it will beat at a very steady pace, like a metronome.
mhm,
And then, of course, the devices can pick up these differences. And while you're busy living your life, concentrating on communication and whatever you're doing, these trackers keep track of the load on your system so that you can see whether your stress balance is sustainable with good health or not. So that
mm,
is kind of the key to this. And of course, these instruments use the heart rate, they use temperature, they
mhm,
use oxygen level, and they use pattern of movement. And combined with millions of users and artificial intelligence, you just have a really, really powerful tool on
mm,
your wrist. available at
Mm,
all times. And I compare it to having a dashboard
mm,
for your physiology at your wrist. And it gives you the power of your health and kind of takes it away from the healthcare system and puts it into your own hands. And it also
mm.
a shift in time from waiting until you get sick until we do something, which is a worldwide strategy for the healthcare system,
Yep.
and to avoiding or minimizing the chances that you will get sick from the lifestyle diseases that is, 80% of the diseases that we treat as a doctor.
Yeah, yeah. So I've been tracking my own HRV for a while because I have my Garmin and I have my Whoop, and they both track pretty nicely. They go up at the same time and they go down at the same time. I'm pretty amazed at that. But some of my listeners might not understand what is a good HRV and what's not so good HRV. How do you say what's good, what's not good?
Yeah, so the number is very individual. So which baseline heart rate variability you have, you shouldn't really compare with anyone else
Hmm.
because the genetic component of it is very, very big. So what you have to look for is what your heart rate variability could be at your best. And this is what then the algorithms and the artificial intelligence will, from the Whoop and Garmin, will give you an answer to how is your stress balance doing right now. So on the Whoop, you get the green.
Hmm.
If you have more than 67% recovery and so on, you'll get a yellow or red. And that will tell you how your stress balance is doing for the
Mm,
moment. So, and that's important thing. So, of course, statistically, the lower your heart rate variability, the
mm,
more chances of you getting like any kind of disease.
mm,
And you can do a search on the internet or Google it. You can use almost any kind of disease and you add heart rate variability and you will
mm.
see tons of research.
Oh,
So a
wow.
low heart rate variability as a sign that your system is under pressure and there's not enough resources allocated to your immune system to do its
Hmm.
job
Hmm.
will make way for any kind of disease.
Mm.
And of course, when you get the disease, it will be further deteriorate, right? So 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 that is how you can use it. So you will probably see that in some phases, for example, of the menstrual cycle,
Hmm.
your heart rate variability will be considerably lower
Mm.
than on other times in the
Yeah,
menstrual cycle,
yeah.
which is why women should really take note of the heart rate variability and both exercise and find the stress balance compared to the menstrual cycle.
Yeah, yeah. I actually just remembered now that you say that my period's actually all over the place because I'm perimenopausal, but my heart rate variability has gone down a bit just before my period, and it's just come up a little bit because my period's here. So that might signal my recovery and how I've my nervous system going up and down.
Mm. Yeah, absolutely.
Yeah, so you should look at the your HRV going up and going down to determine what you should do with your lifestyle. Is that what you're trying to say?
That's right. And in the Whoop band, you can add in the daily journal what you have been doing the last 24 hours.
Yes.
And they will give you an estimate then of whether what you're doing is good or bad for you,
Yeah.
or how it will affect then your heart rate variability. On the
Mm.
Garmin, there's no such system, but I would say that the Garmin system of the stress in the moment and the body battery system that they have bought from the Finnish company Firstbeat, they have
Mm.
bought their algorithms and the way
Okay.
that they present it from the Finnish company Firstbeat. That would be the best. Where I can, for example, yesterday, it's Easter and it's tradition that we have some, candy and chocolate and so
Okay.
on that I probably ate for the first time this year. And I can
Okay, yeah.
clearly see that it stresses me So even if I eat that at 8 o'clock, there will be a stress on my system until 2 o'clock at night.
Oh, wow.
So, and these are the things that is more clearly seen on
Yep.
the Garmin watch, but they don't tell you that. You have to find
Mm,
out yourself. While
mm,
maybe the Whoop band, if you put on that you were eating chocolate and so on,
mm,
would tell you on your weekly or monthly report that when you eat this or that,
mm-hmm,
then this happens.
mm.
So there will be different ways, and you can also have the Oura ring.
Yeah, I was
Um,
just going to ask you, what other devices have you looked into? I only have these two, but other people will have other devices.
yeah, the Oura ring is also a good choice.
Mm-hmm.
They are better at sleep than the other devices, but they're not so good for the overall activity, I would say.
Mm-hmm.
But it's a kind of a low impact one. It's a ring, it's smaller, it's not so invasive.
Yep.
While your Garmin is like having the dashboard always available, that can be too much for some people.
Yep.
Many people would though need that because their stress levels will take some time to figure out. Even with the Pulse Cure as a guidebook,
Mm,
it can take a long time.
mm,
I'm still finding things, new things, after 6 years of using these devices.
mm-hmm,
And it can take some time because your physiology is a very complex
mm,
structure, right?
mm-hmm,
There's so many things happening. And once you start using these devices, you should allow time and patience and
mm-hmm,
acceptance to the process because, of course, most people, and particularly the ones who need it the most, the people who are stressed,
mm,
it can take a long time
mm.
to get this right. Because it's like you've been driving the wrong way for a long time, doing a
Yeah.
lot of things wrong, just like I did.
Yep.
I've done all the mistakes in my book. And so to turn around and have a more healthy lifestyle, it can be a lot of effort to do that.
Mm,
But it's not like you can get away from the effort.
mm-hmm,
Even either you have this kind of controlled effort trying to stay healthy,
mm-hmm.
or you hope for the best, close your eyes and then you get sick, and then the control of your health is out of your hands, to a large degree.
Yep.
It depends if the diagnosis that you get is if there is a cure for it, or how good your doctor or healthcare system is. And with these devices and with the lifestyle that you also prescribe,
Mm-hmm.
you're able to, with some effort daily, to avoid getting into the situation or to minimize the chances of getting sick. So the power
Yeah.
is literally in your own hands.
Absolutely. That's what I like. Empowering people to take charge of their own health rather than just going blindly. So, what about the Apple Watch? Can you do HRV on the Apple Watch? But most people don't wear it for sleep. They just put it on to charge.
Yeah. So the Apple Watch is a lot better than nothing, but they
Mm-hmm.
don't have. I've tried it several times. Maybe they've become better. There is an app called Athletic. It's a combination between athlete and analytic that is
Mm-hmm.
is quite good,
Mm,
but not as good as these other devices in my
mm,
experience. So,
mm-hmm.
but of course, compared to nothing or just guesswork, the problem is that a lot of people say, "Ah, why do we need to use these devices? Can't we just feel how we're doing?" And we
Yeah.
are terrible at that.
Mm,
We have really no clue of our stress balance. And
yeah.
that is on purpose. That is on purpose from nature's side. We have excellent eyesight, excellent taste, excellent smell, hearing, and sense of touch.
Yeah.
So because all the threats throughout history came from the outside.
Mm,
But from the inside, if we had been able to feel the stress levels, that would be in the way or disturbing those signals from the outside, and
ah,
it would
Hello, lose you for a
We
bit.
can see, but whether I have 60
Mm-hmm.
or 80 in heart rate,
Mm,
I have no clue. So and that would be a huge difference in stress levels and load
yeah,
on the system. But I would not know that. And
yeah,
of course, just one or two beats over a long time will mean something.
yeah. I just thought of a scenario. I often ask my patients, especially those busy mums that they're just running around, drop off pickups and non-stop working. I often ask them, "Are you stressed?" And they would say, "Oh, no different than usual." And I interpret this answer as yes, they are stressed because they're always stressed and they're not any different now compared to usual. They've been stressed for so long. Do you agree with
Yeah.
that?
Yeah, I agree with that. And you sort of get used to that level of
Mm,
recovery.
yeah,
So you think that this is the way things are, that it's normal to be tired. It's
yeah,
normal to feel low on energy and fatigued and have some pains here and there, that this is just a part of life, but it's not.
that's right.
And of course, then there will be some things that you have to do when you have small children.
Mm-hmm.
So you have to get them into kindergarten, you have to go to
Mm,
work,
yeah.
you have to buy the groceries and clean the house and so on. But then it becomes really important to identify the energy thieves that you didn't know about. That you
Mm,
understand that eating a pizza with chili and
mm-hmm.
having two beers will knock your recovery out.
Mm,
And that is what you reward yourself with on the Saturday, for example.
yeah.
And so this is a way to find the unnecessary sources of stress that when you see them, you cut them out.
Mm,
For example, nicotine in Norway, we use a kind of nicotine in a small bag that you put under your lip,
mm-hmm.
and 25% of youth use that. And they would say
Okay.
that they use it to calm themselves down. But when you see on the heart rate, it will raise the resting heart rate by 10 beats, like from
Oh,
60 to
wow.
70, and be a huge source of stress.
Yep.
And and so that there will be many of these kinds of stressors. And you would also be able, like you see on your Garmin watch, you will get the VO2 max.
Mm,
So you will be able to see that, okay, my VO2 max is terrible, is really poor. And one of the best indicators of longevity and health level is the VO2 max.
mm,
That tells your fitness level, how well your cells will metabolize energy.
yep.
And if that is really low, if that is in the low 30s or even in the 20s, your body will struggle at daily activities all the time. You
Yep.
don't have any reserve, so that when you're doing nothing, your body is still overworked, you
Mm-hmm.
know?
Mm,
And so, particularly then, you need to exercise really carefully,
mm.
because
What's
any
your
any
suggestions?
exercise will give you a lot of lactic acid, and
Mm-hmm.
you will have an inflamed system
Mm.
that you will feel bad, and you will be demotivated and go for some chocolate instead, right?
Yeah, yeah, that's right. Yeah. So would you suggest these patients to just build up very slowly and increase a little bit at a time, that sort of thing?
Exactly. Almost ridiculously slowly. And
Yeah.
that is because the capacity is so low. So that
Yep.
would be starting by walking and maybe some like intermittent running and then walking and then looking at your Garmin watch, the recovery time afterwards.
Mm-hmm.
So it will depend a lot on your heart rate. So I guess I don't know if you check your recovery time after an exercise. Do you do that?
Not as much actually. I mainly look at the HRV.
Yeah, because when you do an exercise, after the exercise, you will get a recovery time from the Garmin watch, like after a
Oh,
run or
yeah.
so.
Sometimes it's not very indicative. They'll tell me to recover for 48 hours, and I don't
Yeah,
feel like I need that much.
yeah, and that is because we don't. Yeah, but the ideal time would be 48 hours, and
Oh,
and
okay.
what gives you this extra time is the high intensity
Yep.
lactic acid. And
Ah,
I've been, for example, I can probably run in zone 2 for 1.5 hours
okay.
and keep my heart rate maybe at 130, and I will have a recovery time maybe of 24 hours. And I can see it also on the watch that after the run, I will be back in the blue parasympathetic mode more or less immediately afterwards, particularly after a cold shower. But I remember when I tested it for the VO2 max to check it on the treadmill if the VO2 max was valid,
Yep.
then you are running at the maximum speed for 8 minutes until you are cannot run any faster. You have to stop. You're just saying, okay, I quit, I give up, right? To find your maximum VO2 max level. And then I got 96 hours of
Oh,
recovery
wow.
time. And
Okay.
I could see also that instead of going back to the blue parasympathetic mode, I was in the orange stress mode like for a, a couple of days.
Mm,
So so and I think the recovery time, and this is exactly what you're saying because you don't really feel the difference.
mm, mm,
We're not equipped really to feel that
mm,
difference.
mhm,
So the ideal training time, what you're doing when you're exercising is kind of toxic. You
mhm,
are overstraining kind of your capacity.
mhm.
And then you have to allow your body to build itself stronger than it was.
That's right.
So you will feel that you can run the day after, but the ideal would be to wait a little bit longer to allow your body to build itself stronger and then push yourself. So
Yeah.
there will be a lot of if you Google training in HRV, you will see that if you follow HRV, you can train less
Mm-hmm.
and perform better because
Yeah.
you're kind of playing with your body. And so I've seen plenty of athletes, professional athletes that are used to like listen to their bodies, but they
Mm.
overtrain.
Ah,
And you can see that in the heart rate variability.
yeah, yeah. And they get inflamed and they can run into risk of chronic conditions as well.
Yeah, right.
Yeah, yeah. What are your ways to improve one's HRV? So let's say mine's just dropping, I've got no idea. What strategies would you adopt?
Yes, that can depend on what is the problem. Like you said, your HRV was going down now, and it will also vary across the seasons.
Mm-hmm.
Because in the summer, the sunlight will affect our cells.
Mm-hmm.
In it will improve the mitochondria. It will
Mm.
release nitric oxide in our skin.
Yep.
That will make the blood circulation improve. So, and I can most clearly see that when in Norway, I get tagged a lot, because the Pulse has been just this wild bestseller in Norway for close to 2.5 years.
Mm.
So on Instagram, I get a lot of people contacting me asking, why does my heart rate variability change when I go to fly from the north of Norway with literally no sun and then
Mm-hmm.
fly to Thailand for 2 weeks and their heart rate variability doubles. It could go from like 30 to 60, right?
Yep.
But also the small differences that you would see, like in Melbourne, would be you can see now when it comes to fall and winter, it will be lower from the
Mm.
effect of the sun.
Mm-hmm.
So maybe one thing you could do is to be more outside in the sun that is there,
Mm.
and
Okay.
it would still help. Other things you can do, of course, every day is to do breath work, slow
Yes.
breathing. That is
Yes.
very important.
Yep.
It's an invisible thing to do. You can be in a
Mm.
meeting, you can be in a conversation or in a podcast, and breathe slowly when the other person speaks, for example, and nobody will notice how you're
Yes.
breathing, right?
Yes.
And so it's
I
always available, it's always where you are, and it's
Yeah,
free
that's
and
right.
available. Other strategies would be cold.
Yeah,
So
okay.
cold water, cold shower,
Mm-hmm.
turn the temperature down in the bedroom or in your office.
Yep.
You don't need to be cold, but a bit cool is seems to be better for your heart rate variability.
Okay.
Other things you can do is like reading, mindfulness,
Mm-hmm.
meditation.
Yep.
Yeah, whatever works for you. There will also be like devices like NeuroSim, so vagus nerve stimulators.
Oh, yeah.
But in mostly I focus on things that are free.
Yes. Yes, I
So
agree.
so and all of the advice in the Pulse Cure is free, and that is a problem really because there's no commercial pressure behind that.
Mm-hmm.
So it's not possible to monetize on the sun, right?
No,
It's there it's there shining for free. There's nothing to monetize on breath.
that's right.
So so the commercials are all directed towards what costs money, with pills and so on. And that is also why I find I'm optimistic because these devices that there is money to be made
Mm,
from keeping people healthy with these devices. So that's the good thing. And when you see on the devices that the breath work functions
mm-hmm.
and that the cold therapy functions,
Yep.
that makes it more motivating to do the right thing when you can see the results in real
Mm,
time.
yep.
And that is not just what you're doing now will increase your chances of having a good life in 30 years. You know, we're
Mm.
not made for that, but you can see clearly that this works and that the cold, uncomfortable shower will keep you in the parasympathetic mode for a long time.
Yeah.
So, and these are some of the things that you should do. And then, of course, there are things that you should not do to
Mm.
get a better heart rate variability. And that may
Okay.
be the most important ones.
Yep.
And that, of course, number one is alcohol,
Mm.
according to Whoop. And Whoop has a brilliant podcast
Mm-hmm.
that when in their results and people and Whoop knows what people are doing because you put it in the journal
Yes.
and they know that the by far worst stressor is alcohol.
Wow.
And
Mm.
that is what I even and that can tell you how poor we are at understanding because that is what I used to wind down. That is what I used to do to yeah, after a busy evening shift, for example,
Yeah.
at the ER.
Mm-hmm.
I would have a couple of glasses of wine to wind down and then go to sleep and
Okay.
sleep soundly, or so I
Yeah.
thought,
Yeah.
through the night,
Yeah.
and woke up probably tired and thinking, okay, it must have been the hard ER work yesterday that did
Yes.
that because I could clearly feel that I was relaxing from the alcohol and I was even advised, that advice from doctors used to be 2 glasses of wine for
Yes.
men and one for women.
I think those
So,
studies are
so
funded by alcohol companies. Is that right?
I'm not sure, but the confounding factor was loneliness, or
Ah,
that you would tend to have those glasses of wine with someone, so you
okay.
would be more social. And now we know that loneliness is toxic, not
Yes.
only to mental states, but also for heart disease and cancer and
Mm,
all of the diseases. So that was probably the confounding factors that they
mm,
hadn't really corrected for in the research because they
mm.
didn't know it.
Yep.
Just as all the research, now that we know how important sun exposure is,
Yes.
we also know that that is not something they have been correcting for in research. So it's like
Okay.
if you want your research to show a positive result, okay, start in the worst part of winter and have that test go on into the summer, and
Yep.
people will feel better,
Yeah.
right?
Yep.
And
Yep.
also in the biometrics, they will be better. So and the opposite side, if you start in the summer and you end the research in the winter,
Mm,
you'll perform worse. And I guess that no studies have been correcting for this confounding factor. I'm quite sure.
yes. I
So
agree with you. Yep.
so this is how we learn. So that would be um, quitting alcohol is maybe the most effective thing for people. If you
Mm,
have any symptoms, if you have any stressful life, the first thing to cut or minimize would be alcohol.
Yeah.
And then it will be food, because the
Yeah.
worst stressor for most people will be food related.
Mm.
Either that they are eating for too much time of the day. So
Mm-hmm.
most people find that the restricted feeding window of, yeah, from, I would say, from 6 to 10 hours that
Mm-hmm.
you're eating within, for example, from 10 a.m. to 6 p.m.
Mm-hmm.
or noon to 6 p.m. like I do most of
Yep.
the days. That will have a good effect on your heart rate variability. And that
Mm.
is because your intestinal system will be more intact. It will have more time to recover after
Yep.
the time that you're eating, and particularly as most of the food that we eat these days, as you know probably, is ultra processed and is food that our
Mm.
system is not really recognizing, and it's creating inflammation in our system.
Yep.
And then it's even more important to have the downtime in the system when you are fasting and your intestinal system can recover.
Yes.
And also, many people will see that they have food intolerances.
Mm.
Um, so flour-based food with
Yep.
gluten, for example, dairy products. A
Yep.
lot of people will find out that these will be stressful for their system. They will find that,
Mm.
okay, if they eat a salad or if they eat chicken or whatever, it will not affect their stress levels.
Mm. Yep.
And the first time I became aware of this was I was working as a GP, and at the lunchtime, I was usually having a bowl of salad.
Mm-hmm.
But then one day, probably one of the colleagues had a birthday or was, for some reason there was a cake. And I
Yep.
thought, okay, let's skip the salad today and just
Mm-hmm.
have two big slices of cake. It's even
Mm.
free. And I could see that my heart rate went up like 15 from like 60 to 75. And there
Wow.
was no difference. I did exactly the same job afterwards, and my
Yep.
stress levels would be high for like 6 hours because of
Yeah.
two slices of cake. And then I understood that, okay, there's something here. What's this? I
Yes.
had never thought that food had anything to do with stress.
Yep.
And I could also feel it after a while. I got better at feeling, so I could feel the inflammation from this food. That it was like having like 20% of a flu,
Oh,
to put it
wow.
like that. So
Okay.
you just feel this, okay, there's something going on now in
Yep.
my system. And you see on your watch, okay, yeah, it is stress on the watch
Yeah.
also. So to identify the foods that you get stressed by is important.
Yeah.
Chili is another big factor for me and many people. And
Mm-hmm.
of course, a lot of people use chili to enhance the flavor of so many
Yep.
products, right?
Mm.
So that would be a problem. Yeah, so
I,
that would be some of the things
yeah.
to implement.
I think that's great to learn more about your body. It's like wearing a continuous glucose meter. Then you can
Mm.
see the glucose go up when you eat a big bowl of pasta or something. And then if we eat the sugar and we see the HRV going worse and are stressing our body system out, then we can learn to learn it's not worth it. It's not worth eating just two slices of cake. And remember for next time that better not do it.
Yeah, exactly. And it also tells us that we don't have an alarm system for
Mm,
this. We
yep.
have alarm systems in our body for the ancient threats. If
Mm,
if you had a small stone in your shoe, you will feel it, right?
yep.
If there's a small cut of a paper cut or whatever, you will immediately be drawn to that. If you sprain your ankle, you'll
Mm,
have pain.
mm,
You will immediately feel these uh, different alarm signals. If you are in the sun and get sunburnt, there's an alarm signal. It will be painful.
mm,
And but the diseases that threatens us now is high blood sugar, is high
mm,
blood pressure.
yep.
We don't feel it. So you can have a really, really high blood sugars and you don't feel that.
Mm.
So this is why we need these devices as extra senses that we never needed to develop, but now we need them. We need to
Yeah.
see on the CGM that you shouldn't eat that cake, or at least not that often. You
Mm.
shouldn't eat cereals in the morning. You
Mm.
shouldn't eat so much bread or pasta or whatever. And in the same way, we can see the same things in the heart rate when it comes to things that stresses us.
Yeah.
So this and the good thing is that this new technology points backwards in time. It points back to a lifestyle that our ancestors lived.
Mm. Mm-hmm.
And we don't need to go all the way back there with a bow and arrow and running naked around, but we need to a little bit towards that lifestyle. Get enough
Mm.
sunlight,
Mm-hmm.
sleep enough,
Mm-hmm.
be exposed to temperature changes,
Mm.
moving enough, and being able to rest when nothing is happening instead of checking our phones and mails and what everybody is, of course, doing.
Mm-hmm.
So, and unless we do some effort in that way, there will be a price to pay at the
Mm.
other end, in my experience. And I live from people who get sick, right? We all do in the healthcare system, and that is
Mm.
part of what is the problem, that there's too much money to be made on sick people. So
Mm.
there's no incentive to get them healthy because
Mm.
we're all working on sick people after they get sick, right?
Yeah.
So even me as a normal doctor, even if I'm not, say, if we were cured of the lifestyle diseases, the number visiting at and one person with a poor lifestyle will have 5 different diseases, right?
Yes.
It will just add one every other year from their 60. They will get stomach problems. They will
Mm.
get some depression. They
Mm.
will need medications for hypertension, for diabetes,
Mm-hmm.
for some allergic symptoms, from
Yeah.
thyroid problems, and pain medicine. And so they will need to go to 5 different specialists to get the control of their migraine and so on. So, and a healthy person, and you only need to do the free things that nobody's making any money of.
Mm.
And then you will be relieved, or most people will be relieved of so many of these symptoms when you prescribe lifestyle medicine, of course. But then
Yeah.
then
Yeah.
then nobody's making money from them. So
I
that is
think all of
it is
the
actually a problem.
Yeah, I think all of the doctors want the patients to be well and healthy and getting better, but I don't think we're really taught on how to do that until I have deliberately dived into it.
Hmm. Yeah,
Mm.
yeah, I agree. We didn't learn that in medical school,
No.
and I've currently written a book or co-written a book on the vagus nerve,
Okay.
and I got into the bookstore to see if the books were different, and they seem that they're more like 80-90% is just exactly the same information that I was reading
Mm.
30 or 35 years ago.
Mm.
So the textbooks is not teaching us the new information that has transformed
Hmm.
medicine, I would say, the last 5 or 10 years on lifestyle medicine, on how to gut microbiome, epigenetics,
Yeah.
sleep, stress, everything that we now know. And I'm on many, many podcasts, and I know that the health concerned person will know this better than their doctors.
Yes.
So I'm not sure if it's the same in Australia, but
It is. I have so many patients that's researched everything and they know much more than I do. And I probably know a little bit more than their usual doctor. That's why they come and see me and I can relate to them a little bit better.
yeah.
Ye- Yeah. So I just want to ask you, which device or which watch do you suggest to people? And if people don't have a device, they don't have a watch or a Whoop, what can they do? Can they just have a phone to measure the HRV?
Yeah, actually, there would be many apps that uses the torch on the phone and the camera
Oh, okay.
to give you. So probably you could just put in your App Store or the Google Play, I think it's
Hmm.
called,
Yep.
uh, search HRV app, and you would find
Mm,
many of them probably.
okay.
And so that you could use in the morning, for example. The morning time would be the best then,
Hmm.
immediately before you get out of bed to see your heart rate variability.
Mm,
You could also just feel your heart rate, and record the number. And my editor on the Pulse Cure were very specific about that. You wouldn't need a device to use the strategies in the Pulse Cure. So the
mm,
strategies in the Pulse Cure is just the best strategies on sleep, movement, exercise, nutrition, all of these things. And then with the added bonus that we can track these using the
oh,
wearables.
okay. Yep.
So you don't need that but it's of course easier to navigate when you get the result
Mm,
immediately on your watch. And then with devices, I would, as I said, the Garmin is by far the best option
yep.
and probably also the cheapest option. I think that both the Oura Ring and the Whoop Band is twice the price of the cheapest good enough Garmin watch.
Mm,
And the Whoop, is an annual uh,
subscription. Yeah.
subscription. Um, so I would think that the Garmin watches would be the best by far. And then if you feel that you have an Apple Watch, you don't want to change it, then of course having a Whoop band with no screen on it
Mm,
doesn't look as weird as having two watches, on
mm,
each hand.
yep.
And the Oura Ring can be used. And I know that many people are concerned about the EMF. And
Mm,
then I would say that both at least probably on the boot band as well, maybe, that there's a flight mode. So you can put it into flight mode and the device will just register and then you can transmit the information when you
mm.
take it off the flight mode and just synchronize.
Oh, okay. I haven't used the flight mode before. I'll give it a go.
Mm.
That is
Mm.
amazing. That's amazing. I love all your information, Torkil, and it's
Mm.
very, very similar to what I like to preach and talk about in the Prescribing Lifestyle podcast.
Mm.
Yeah, so
Yeah, it's great that you have that. Yeah.
I suggest all my li listeners to check out your book, The Pulse Cure, with all the lifestyle things, not just about HIV, but about all the things that you can do to improve your lifestyle.
Yeah, and I would say, of course, in Australia, I'm not sure they have it stocked, so it would take some time for the paperback version, but there is both an ebook and an audiobook. So it's probably a lot of podcast listeners would rather have the audiobook. So that would be
Yes.
even on the iPhone, you can just put it in the book there, the app that
Yeah,
is
yeah.
integrated in the iPhone.
I like the Audible better because I go walking, running a lot, and it's
Hmm.
I don't sit down and read a book myself.
Yeah, I think it's a 7 hour book, and
Okay,
in
well,
those
that's all
7
right.
hours you know what to do because we really needed 6 years of education
Yeah.
to understand all the different diseases and
Yes.
what to do about them, but to learn what you need to do to avoid them, that would take those 7 hours, I would say. Then you have insight into what you should do. uh, to maximize your chances of living longer and keeping your health span and your brain span for the period as well.
Yeah, yeah, amazing. I think I'll go and download on my Audible soon. So
Mm. Yeah, yeah.
great, Torkil. Well, thank you so much. Where can my listeners find you?
They could find me on Instagram. I'm
Mhm.
dr.torkil.
Okay.
So I will probably use more the English version now. I've been trying to combine the Norwegian and English. It seemed a bit hard.
Yeah.
So there's also an Instagram called doc_Torkil that I will use more from now on with just English speaking content.
Okay, great. I was
Uh,
going through your Instagram and there's maybe 2 out of 10 videos
Yeah,
that's English.
exactly. So it seems to be hard as long as it's like more than 35,000 followers, and most of them, of course, is Norwegian. So it's been
Yeah,
a bit difficult to
sure.
find the balance there. But I think I just need to step up the English speaking ones and try to divide them. Mm.
Okay, great. No problem. Well, thank you for coming on, Tokyo. Thank you for your time.
Thank you for having me, and have a nice time in Australia. Now it's evening time for you, huh? Yeah.
It is, it's almost bedtime. Well, thank you,
All right. All
listeners,
right.
for listening to the Prescribing Lifestyle podcast. I hope you like this episode. And as I always say, if you don't look after yourself, you can't look after anybody else. So thank you, Tokyo, and thank you, all the listeners, for paying attention to this episode. Until next time, I'll bring to you another guest.